What if your anxiety isn't purely psychological? What if your brain fog isn't about productivity? What if your low mood isn't a character flaw? What if the root cause is metabolic? Your brain consumes more energy than any other organ. And the hormone that regulates that energy is thyroid hormone. Tonight, we explore how T3 influences neurotransmitters, emotional stability, memory formation, and mental clarity. Because sometimes, the problem isn't your thoughts. It's the signal powering them. The brain represents only about 2% of body weight. Yet it consumes roughly 20% of total energy at rest. Neurons depend on ATP, oxygen, stable glucose metabolism, and mitochondrial efficiency. And mitochondrial efficiency depends heavily on T3. When T3 signaling declines, neural firing slows, synaptic transmission weakens. Cognitive processing becomes sluggish. This is brain fog at a cellular level. Thyroid hormones influence serotonin synthesis, dopamine signaling, norepinephrine receptor sensitivity, and GABA balance. Low thyroid function may reduce serotonin availability. This contributes to depressive symptoms. High thyroid activity may amplify norepinephrine sensitivity. This contributes to anxiety-like symptoms. Mood is biochemical, and thyroid hormone participates in that chemistry. There is strong clinical association between hypothyroidism and depression. Symptoms may include persistent low mood, loss of motivation, cognitive slowing, reduced concentration, and emotional flatness. In some cases, correcting thyroid imbalance improves depressive symptoms significantly, not because thyroid replaces therapy, but because energy signaling stabilizes. The brain regains metabolic resilience. Excess thyroid hormone increases sympathetic nervous system activity. The result: restlessness, irritability, racing thoughts, panic-like sensations, and insomnia. The body is in overdrive. The brain interprets metabolic acceleration as threat. This is not imagined anxiety. It is biochemical overstimulation. The hippocampus is essential for memory consolidation. It is highly sensitive to metabolic changes. T3 supports synaptic plasticity, neurogenesis, and mitochondrial function. Low T3 signaling may impair memory formation. High chronic cortisol combined with low T3 may shrink hippocampal resilience over time. Stress and thyroid function are deeply interconnected in cognitive health. Brain fog is not a formal diagnosis, but it is a real experience. It often includes slowed thinking, word-finding difficulty, reduced focus, and mental fatigue. At the cellular level, reduced T3 gives reduced mitochondrial ATP gives reduced neural firing efficiency. It's not laziness, it's bioenergetic constraint. Chronic inflammation affects both thyroid conversion and brain signaling. Cytokines can reduce T3 receptor sensitivity, impair neurotransmitter synthesis, and disrupt blood-brain barrier integrity. Low-grade inflammation creates metabolic resistance inside neural tissue. The mind slows, mood destabilizes, energy drops. In autoimmune thyroid conditions, hormone levels may fluctuate. This creates mood instability. 1 week, anxiety, irritability, sleep disturbance. Next week, fatigue, low mood, mental slowing. These shifts are not personality inconsistencies, they are endocrine fluctuations. Understanding this reduces self-blame. Thyroid hormone interacts with circadian rhythm. Poor sleep reduces T4 to T3 conversion. Reduced T3 reduces deep sleep quality. A vicious cycle forms. Less sleep gives less conversion, gives less energy, gives more cognitive impairment. Restoring rhythm stabilizes both mood and metabolism. Chronic stress elevates cortisol. Cortisol suppresses thyroid conversion. Low T3 reduces mitochondrial output. Reduced mitochondrial output impairs emotional regulation networks. Stress becomes harder to manage. Emotional resilience drops. This is not weakness. It is physiological overload. The prefrontal cortex governs decision-making, focus, impulse control, and emotional regulation. These processes require stable ATP supply. When thyroid signaling declines, executive function weakens. People may feel overwhelmed, indecisive, mentally fatigued. Energy fuels clarity. Emerging research suggests HRV correlates with mood shifts in thyroid imbalance. Continuous temperature tracking may predict mood dips, and AI models can detect subtle metabolic cognitive patterns. The future of mental wellness integrates endocrine awareness. Psychiatry and endocrinology are converging. Signs your mind may be responding to thyroid imbalance, persistent brain fog, mood swings without clear triggers, anxiety with normal psychological evaluation, low motivation, memory decline, and sleep disturbance. These do not confirm thyroid dysfunction, but they invite investigation. The brain listens to metabolic signals. Support pillars: 1. Stabilize circadian rhythm. 2. Reduce chronic stress load. 3. Optimize micronutrients: selenium, iron, zinc. 4. Support gut health. 5. Engage in resistance training. 6. Avoid extreme caloric restriction. 7. Monitor thyroid labs alongside symptoms. Mental clarity often improves when metabolic signaling stabilizes. The goal is not hyperoptimization, it is steady energy. Your thoughts require energy. Your emotions require biochemical stability. Your clarity requires mitochondrial throughput. Thyroid hormone influences all three. If you felt mentally slower, more anxious, less resilient, it may not be just stress. It may not be just personality. It may be signaling. In our next episode, we move deeper into autoimmune thyroid disorders, where the immune system itself alters this delicate balance. Because metabolism, mood, and immunity are inseparable. This is Health Reimagined. If this changed how you view mental health, subscribe and continue to Episode 7, Autoimmune Fire, Hashimoto's, and Graves Explained.